Hi, I'm Dr. Rekha Kumar, Found's Chief Medical Officer. I'd love to tell you about a scenario I run into frequently where patients may see me for their weight or their overweight or their abnormal weight gain, and they're really reluctant to try anti-obesity medication. I think it's so important for physicians to meet their patients where they are, and I always say to my patients that our weight journey is going to be a combination of behavior change plus medicine if they choose to try it. And I always, explain that our weight is controlled by our biology. 60 to 80% of our body weight is probably genetically or biologically determined. And we also discuss behavior. Initially, a patient may say to me they're not comfortable taking medicine, and I let them know that I'm comfortable supporting them with just behavioral intervention. But I really emphasize that if they struggle or if they feel like they're not seeing results, that they shouldn't feel embarrassed or defeated, and it's likely their biology that's fighting them. When it's framed in that context, if we try behavioral intervention first and it's not sufficient, patients feel comfortable returning and starting medicine. And when that happens, they will often notice that all of the behavior change they were doing suddenly is working because we've addressed the biology side. So adding medicine to lifestyle intervention, and I'd hate to say convincing, but educating patients that medicine might be an essential part of their success, is a gratifying part of my job when I see people eventually go on to medicine and it is the game changer for them.